Our goal in this video is that by the end you're going to know everything you could possibly need to know in order to ace any exam on both the radius and ulna, the two bones in the forearm or antebrachium. And to do this, we're going to be using a 100% free Kenhub article that you can go ahead and find down in the description below, and you can follow along as we go through this. Now, these articles are absolutely amazing, and you can even see at the very top of the article there's going to be a video. Now, you're not going to be able to see the whole thing unless you are a premium subscriber, but at the same time, this is going to be there for you. But if you scroll down, that's where you get to see our very first image. And we're going to focus on the radius first, because again, there is the radius and the ulna in the forearm. Now, the radius is rad. And the reason I say that is because you say rad and you kind of do this thumbs up position, the radius is the bone on the side with the thumb. So no matter which way you flip and flop your entire arm here, this is called supination and pronation is the action that I'm doing. The radius is the bone that is actually flipping and flopping. Right? What I want you to do is I want you to just kind of feel your elbow. And then you're going to feel that there's a long bone coming from your elbow towards your pinky. That is the ulna. The ulna is going to stay put. And what I want you to do with your palm up, I then want you to rotate to where your palm is now facing downwards. The ulna stayed put. You can feel the skin sliding underneath, but the ulna is not moving. Instead, it's the radius that is flip-flopping around. The radius is the more mobile bone. It's on the thumb side, so therefore, the radius is rad. And sure enough, that's exactly what we can see highlighted here. In green, this is the radius, and you can see that it is going to be on the thumb side. Now, what our goal is here is to show not only just the radius, but also the individual bony landmarks associated with the radius. Now, a bony landmark can be a spot where a muscle is attaching, a ligament is attaching, or possibly where the bone is articulating with another bone, right? As you can see if you look closely here, the radius is physically touching the ulna. So therefore, that point in which they articulate, that is going to be a bony landmark. And so we're going to just go through several of these to give you a deeper understanding of both the radius and the ulna. So first up, well, you can also see it in anatomical position here, which is pretty nice. So you can see just kind of the radius resting like this. And if we go down, it's also showing the ulna. And then we can see that the ulna from anatomical position here. So let's go ahead and keep scrolling. You can see how these articles look as I'm kind of scrolling down. You can also see a quiz that's going to be here. Again, the quiz, this is part of a premium subscription, but at the same time, I strongly encourage all of you to go ahead and check it out because this is the single best way to study, bar none. There's no question in my mind. Studying through quizzes is the most effective way to learn information. Now, if we're looking at here, what we can see is the radius, but we can see the very top of it highlighted here in green. And this is what is called the head of the radius. And the head of the radius is going to be articulating with this little circle here. This is called the capitulum of the humerus. I like to think that it's a little cap for the head, if you see what I did there. So capitulum of the humerus is going to directly articulate with the head of the radius. And what's happening is when you are supinating and pronating and that radius is just rotating, it's just spinning, right? Like you actually have like this spinning motion like this that is occurring with the humerus at the elbow joint. But then you also have the articular circumference, and that's just a portion of the head of the radius. That is what's basically going to be doing all of the sliding as it's going around, in really articulating here at the ulna. But we then have the annular ligament. Now this is not technically part of the radius, but it's what's binding the radius to the ulna itself. So you can see that we've zoomed in, and this is a ligament. So if you think like annual, right, anniversary just kind of means circular. What's happening is the annular ligament is going from the ulna, wrapping around, and imagine this is like a horseshoe type shape or like a U shape, and it's going to completely attach the ulna and the radius together, and then it's also going to allow for that rotation to occur. So that's going to be the annular ligament. Then we have the neck of the radius. Now, The neck is exactly what, I mean, if you have a head, you got to have a neck, because we're also going to see that there is a body of the radius as well. So this is really just going to be bridging the head with that body. And then the last image we have in this set of images is what's called the radial tuberosity. Now, a tuberosity just means multiple bumps. The way my students have always remembered that is that a tuberosity is like a city of bumps. There are multiple bumps. And if you were to feel the radial tuberosity, it's not like it feels like a bunch of little bumps as much as it's just kind of bumpy, right? It's not like it's braille or something like that, but it's still going to be bumpy, and that's what creates the tuberosity. This is actually the insertion point for the biceps brachii muscle as it comes down in order to supinate and then flex the elbow at this area, right? So let's keep going with this as we move down. And this is where we start to get to the shaft, or really the body of the radius. And what we can see here is what's called the anterior border. Now, this is something that's better to, if you had a real bone, or at least like a synthetic bone, like a skeleton, maybe you could see this next time you're in your classroom, you can see that there's ridge lines on the radius. And there is one in the front, and that is what we call the anterior border, but there's also going to be one on the back side, which is what we call the posterior border. But that's not enough. There's even an interosseous border. And so to really understand what the interosseous border is, this is where the interosseous membrane, which is what connects both the radius and the ulna, is going to be attaching to on the radius. That interosseous membrane is a fibrous joint. This is going to help kind of distribute forces between the two bones. Like, let's say like you land on your wrists, instead of all that force going through one bone, it can start to kind of evenly distribute itself throughout the interosseous membrane, and that's going to be highly beneficial. So that is the interosseous border. So we had an anterior, posterior, and interosseous border. But then we also have surfaces. And this right here is what's called the lateral surface. And the lateral surface is exactly where you'd think, right? So if you were to feel the lateral part of the bone, that is going to just have this smooth surface. We call that the lateral surface. But then you're going to also have an anterior surface, which again, to absolutely no surprise, would be on the anterior aspect of the bone itself. And that's what you can see here in green. But then we also have a posterior surface, which is just going to be this one on the back side. And so when you put that all together, like, we have pretty accurately described the entire body of the radius. But that's not it, though, because what we haven't discussed yet is going to be the most distal aspect of the radius, which is actually the most clinically relevant, because this is where you're likely to break your wrist. If you are someone who breaks their wrist. So we'll kind of scan down, and what we can see here is these zoomed in portions on the distal aspect of the radius. And first we have what's called the styloid process. So the styloid process is this little nubby. And I want you to feel this on yourself, right? If you kind of go to your wrist, and then you can feel there's two bumps, and I want you to just kind of move your wrist around to make sure you're feeling those. These two bumps are the styloid processes. One of them belongs to the radius. The other we're going to see belongs to the ulna. And so this styloid process is very typical, or typically broken, I should say. So if someone breaks their wrist, it's very likely that it's either this or some other aspect of the distal portion of the radius. But if we look at these styloid processes right here, you can see that they kind of create this border. And this is important. This is what we're going to see here, is this is where carpal bones, the actual wrist, is going to be articulating in this area. So it creates these borders for the wrist bones, the carpal bones, and that's why they're going to be there. So then what we can see here is the ulnar notch. So the ulnar notch is exactly what it sounds like. It's where the ulna is going to actually be plugging into, but you're just seeing a medical image of it, but we can see it a little bit better right here. So this is going to be the ulnar notch, but we can zoom in and you can see that here's the ulna, and you can see that it is just resting in this little groove on that surface of the radius. So that would be the ulnar notch. And then we're going to have the dorsal radius or dorsal radial tubercle. So remember, tuberosity means multiple bumps, but tubercle means one bump. So just a large projection, and this is going to be on the posterior side of the radius, which is why it says dorsal. Remember, dorsal just meaning back surface or just towards the back. And so this is just going to be a projection of bone that is coming out here. And then we have the carpal articular surface. And so this is where you have the lunate and scaphoid bones of the carpus. So there's 8 carpal bones, but the lunate and the scaphoid are the 2 that are going to be articulating here at the articular surface. So this is, again, the carpal articular surface of the radius. It's just the portion that is directly interacting with those carpal bones. Then we can go ahead and slide down, and what's interesting is we've now handled all of the radius, but what's cool is we can look at it from this perspective here, which is showing you also some of the bony landmarks of the ulna, even though we haven't discussed those yet, but they are still here. And this is something that's so powerful about our articles, is because what you're going to see in between all of this, if I kind of go up here, is it's kind of explaining everything that I just went over, but then you can see all of these in action. And so this is a really nice summary image in my estimation. But we can also see, this is, by the way, an anterior view. I can hit this and we can see a posterior view, and it is going off and telling you different aspects of that radius once more. So really, really powerful, and in my opinion, just a phenomenal way to learn your anatomy is to read it, see the images, read more, see more images, so on and so forth. All right. So now what we're going to do is we're going to move to the ulna. So the ulna is going to be the more medial of the bones, and like I said, this is the stationary bone, right? So if we go back to this this position here, you can feel your elbow. We're going to actually give a name to this because technically the elbow is the joint. What you're feeling here is what's highlighted here in green called the olecranon, but we'll get there in just a second. But if you feel your olecranon and then again hold onto the ulna, you can see that the ulna is not going to move, right? The ulna is the portion that is mostly interacting with the humerus. Again, we saw the radius is also interacting and articulating with the humerus, but we're going to see that there's a lot more of the ulna that is doing that. But this is the medial of the 2 bones. And so this large portion here, like I just discussed, is called the olecranon, or olecranon process. This is what you would think of typically as your elbow. Then, what this is trying to show you is a cross-section of the actual elbow joint. And so you can see the humerus, and then you can see some of the soft tissues associated with it, like you can see triceps brachii, you can see, this is going to be probably, it's brachialis coming down here, and then you can see just other ligaments that are going to be associated with it. But I want you to take note of this green line here, because what you're looking at is this right here is the ulna. This again is the humerus. This portion of the humerus is what is called the trochlea. Trochlea is essentially means pulley. And around it there is a groove or a notch that we call the trochlear notch of the ulna. So it's kind of like, imagine like this type of position. So ignore these fingers, right? So imagine you have like this kind of C shape. And then what it does is it wraps around the trochlea, and then it will go like this and move around, and that's what creates that hinge-like motion between the ulna and the humerus, or just the elbow joint. In general, is primarily going to be this right here. So this is what's called the trochlear notch. And then what we have is what's called the coronoid process. So coronoid process is this really sharp tip. And what it's going to do, so you can see it right here, this is on the anterior aspect of the ulna. And so what happens is when you flex your elbow, this sharp tip of the coronoid process is going to plug into this, opposing fossa. It's called the coronoid fossa. It's this little ditch. And so what it does is it kind of just like goes and lands right in there, and that is when you are in that fully flexed position. So you don't just have bone running into bone, but it's kind of just meeting up with this convex and more concave shape. So then we have what's called the ulnar tuberosity, or the tuberosity of the ulna. This is the insertion point, or one of the insertion points for the brachialis muscle, but I actually should say so is the coronoid process. So the coronoid process and this down here, we can see it unhighlighted, the ulnar tuberosity, but now we can see it here. These are going to be the insertion sites for the brachialis muscle, and brachialis being the prime mover in elbow flexion. So it's the main muscle doing this. Biceps is going to be on top or superficial to the brachialis. So then what we have is the radial notch. And so the radial notch, what we can kind of see in this image, so it's kind of hard to see it from here. So if we zoom in, you can see here's again that head of the radius. There's this little notch on the side of the ulna that the head plugs into, and we call that the radial notch of the ulna. And so as the ulna is spinning around, it is spinning inside of that notch. All right, so we're going to continue going down here, and now we're going to see, we're getting to that shaft, or the body more so, of the ulna. And just like we saw in the radius, we're going to see that there is an anterior border. So if you were to fill this, there is a bit of a ridge line there. And then there is also going to be a posterior border of the ulna as well on this back side. And then once again, we're going to see an interosseous border, right? So these bones are very similar in that sense. This is once again going to be where that interosseous membrane is going to be attaching to that ulna. So then what we have is the anterior surface. Again, we saw this very similarly. This is just going to be the literal surface of the ulna as on the anterior side based on anatomical position. Then we have a posterior surface as well, which is to absolutely no surprise whatsoever. But then you're also going to have a medial surface. So the medial surface, so remember, like the ulna is on the side of the hand with the pinky, whereas the radius, remember, was rad, is on the side of the thumb. So for an anatomical position, what that means is there's a whole side right here of the ulna. We just call that the medial surface. That's what its name is going to be. So then what we have is what's called the supinator crest. The supinator crest is going to be an attachment site for the supinator muscle. And to absolutely no surprise whatsoever, the supinator is what is going to help supinate. It works with biceps brachii in order to supinate those radial ulnar joints. All right, so then we are almost done with this. We can finally make our way to the most distal aspect of the ulna, and we find the head of the ulna. And that sounds kind of counterintuitive, or at least it did to me the first time I heard it, because you would kind of think like the head would be up here, right? The head of the humerus, the head of the radius. But the head of the ulna doesn't seem to match up, but that's, the way I always look at it is it's more head shaped, right? It's like the olecranon is more of like this shallow groove. It kind of like, not shallow, but I mean it's more of a groove. It's a notch, right, with the trochlear notch on the other side. Its shape just doesn't really indicate or scream head, whereas for the ulna, it's much more head shaped. It's the best I got, so I hope that works with you. We can just see it from a different position here. So then what we can see over here is the styloid process. And I mentioned that there are two of them. So we have the styloid process of the radius, but there's also a styloid process of the ulna. Now this is more so on the dorsal side of your hand. So the dorsal or back side or posterior side of your hand, that is where you're going to feel more of that styloid process. But just like with the styloid process of the radius, this is going to help form this border that the carpal bones are going to kind of like work within, right? And so they're kind of like just defines the border that they can operate within. And then we see the ulnar notch of the radius, again, kind of just showing where the ulna would actually be plugging into it. But then we can also see a series of connective tissues, and this is going to be the triangular fibrocartilage. And so remember, fibrocartilage is all about shock absorption. And what this complex does is just help absorb shock as it is transmitted from the hand to the ulna and to the radius. It's going to work very closely with the interosseous membrane to help distribute forces. Remember, like, we use our hands a lot, right? And we don't want to be breaking things. So anytime we can absorb shock and distribute forces, that is going to be a really smart move. But then as I scroll down, you can see we have made our way to the very end of this article. What's cool is you can always see if we have, if there is anything of interesting clinical note, we like to put that at the end of every single one of these articles. You can even see it discussing the blood supply between the radial, the ulnar artery, and the anterior and posterior interosseous arteries. But you can just see just how, in depth these articles are. And remember, you can always go back up. Let's see, I think it's a little bit farther up. You can see quizzes, right? So again, if you are a premium subscriber, please go check that out. However, even if you're not, you can go check it out and kind of get dip your toes in and see how our quiz modes actually work, because this, again, in my opinion, is the single best way to learn, just simply because we have study sessions, we have exam quizzes. Like, the study session quizzes are literally built in a way where, yes, it's quizzing you, but it quizzes you so that you learn. Whereas the exam quiz is more testing you to see what you already already have learned. So strongly encourage it. But once again, you can go ahead and find a link to this 100% free Kenhub article down in the description below. But I really hope you enjoyed hanging out with me. I know you're going to absolutely ace any exam coming your way on the radius and ulna, but while you're down there and you're checking out that link in the description, might as well like this video. That small little gesture actually goes a long way and helps this video perform better. But you can also leave us a comment down below and let us know what kind of topics you want us to discuss in the future. There is a lot to the human body, and we are always looking to describe and talk about the things that you are interested in. But thanks for hanging out with me, and I will see you next time.